Thank you everyone for joining us today for the Attitude of Gratitude webinar. We have Dr. Annemarie Mikowski from Excellus BlueCross BlueShield here, along with Jason Morchall, our Excellus consultant. For wellbeing, excuse me. We are going to hand things off. If you have any questions, please feel free to put those in the chat and we'll get to those at the end. Otherwise, we'll just take questions at the end if they come to you then. All yours, Jason.
Awesome. Jess, thank you so much. Kylie, to the consortium, certainly happy to be here and continue to work with you guys, such a unique group, and, just glad to be a partner. So we are here today. We are looking at the Cultivating Gratitude for Your Wellbeing workshop. I'm extremely pleased to, have our guest speaker and introduce her. Dr. Annemarie Mikowski. She, as you can see, based upon her bio, she's a board-certified psychiatrist and behavioral health medical director here at Excellus BlueCross BlueShield. She attended Canisius University in Buffalo for her undergraduate education prior to obtaining her medical degree at Des Moines University College of Osteopathic Medicine in Iowa. She completed her psychiatry residency program at the Jacobs School of Medicine and Biomedical Sciences at the University of Buffalo. So, very esteemed in terms of her education and background. At SUNY Buffalo, you can see she continued as faculty teaching numerous didactics for medical students as well as residents. She provided clinical and psychotherapy supervision at the Erie County Medical Center of Behavioral Health Clinic. In addition to that, Dr. Mikowski has been recognized as a top doctor in psychiatry by Buffalo Spree magazine. And obviously she's supported by her family, an avid Buffalo Bills fan, and just a wonderful colleague to work with. Her knowledge and various topics regarding behavioral health is certainly coming from an expert. So today's presentation, certainly you're going to learn a lot, and certainly, just happy to have Dr. Mikowski, bring this presentation and workshop to the Greater Tompkins Consortium. So with that, Dr. Mikowski, I'm going to flip it over to you.
Okay, well, thank you very much. I really appreciate that very lovely introduction. I find this is right up my alley because I teach cognitive behavioral therapy, and there's a big overlap with positive psychology and these types of practices, gratitude practices. So it's really a lot of fun for me to do a deep dive into this for you today. I will say the agenda here, we have a few different things we're going to run through regarding gratitude, how it affects us, why it affects us, why it's important, how we can practice gratitude despite some of the challenges we might face. And then we'll end with some resources and hopefully some time for some nice discussion. So with that, let's look at the beginning here. How do we define gratitude? So what is it? It's more than just saying thank you. It's a way of experiencing our world. The word gratitude, derived from Latin, gratia, means gratefulness or thankfulness. And in its simplest form, gratitude refers to a state of thankfulness or a state of well-being. However, it's not really something felt in response to something you've been given or earned. It's a deeper concept that comes with awareness and being in the moment. Gratitude is very subjective, and it's the appreciation of what's valuable and meaningful to oneself. A really practical clinical definition we use, gratitude is the appreciation of what is valuable and meaningful to oneself. So it's more than just a momentary good feeling. It's a powerful human experience that we can all share. And scientists who have studied gratitude interventions, such as gratitude letters or journals, they found benefits for emotional health and physical well-being. And that's some of what we'll talk about today. So what is gratitude and why is it so important? This concept is from Robert Emmons, professor of psychology at the University of California, Davis. Gratitude has been studied by Dr. by Dr. Emmons, and it's actually defined in having two parts, according to him. The first is an affirmation of goodness, where people can learn to wake up and feel good about what's around them, noticing gifts they've received. And the second part of gratitude is recognizing that the source of this goodness comes from outside the self. We're recognizing gifts from other people, or depending on belief systems, from a higher power, fate, or the natural world. So in other words, gratitude helps us realize that we wouldn't be where we are without something from others or the help of others. So gratitude is a really pro-social experience, often relying on our connectivity. Okay, next slide. It's impossible to appreciate what we have if we're in a constant state of deprivation or wanting, where things aren't enough. Think of gratitude as being on a continuum where there are different levels of gratitude, from someone who has a short feeling of gratitude, still powerful, to what might be considered a grateful person who habitually practices gratitude, looking at life through this sort of lens. We can align levels of gratitude from very basic habits like thank yous to that deep, abiding sense of thankfulness for life as our foundational orientation. So the goal is to strive to that place of gratefulness as a way of life because of the benefits it provides. People at this end of the continuum experience positive feelings. They may be happier, more satisfied. And in turn, that affects those around them as the benefactors of more generosity and compassion, according to some of the research. Many of us are going to fall in between these extremes. Some days we may orient towards one extreme more than another, and even grateful people will have times where they may feel deprived, or they may really feel injustices are being committed, right? That said, grateful people, those who experience a positive orientation towards themselves, others, and the world, in general, they tend towards more positive behaviors and functional outcomes. Let's think about the benefits of gratitude. Contemporary research on gratitude interventions show that repeated mindful gratitude practice strengthens positive neural pathways and attentional biases towards beneficial experiences. Over time, consistent gratitude practice can raise baseline happiness, improve emotional regulation, and foster long-term well-being. Unlike wealth or accident exposure, which are external events, gratitude practice is an internal, controlled, and intentional intervention that gradually remodels cognition so you can interact with the word differently. So we think of this as like points on a triangle, but you could also think of it as a circle, one thing affecting the next. Next, let's think about gratitude and our brain. The evidence from neuroscience and positive psychology supports health benefits of experiencing gratitude. First, there's neuroplasticity and brain rewiring. Regular gratitude practices actually activate brain regions involved in reward, motivation, emotion regulation, and social cognition. So that includes some of our prefrontal cortex. It includes the hypothalamus and other structures. These activations lead to dopamine and serotonin release. Those are neurotransmitters that reinforce our experiences. Over weeks and months, repeated practice strengthens neural pathways associated with noticing and savoring positive events and reduces default negativity biases. Psychological and behavioral effects. Consistent gratitude has been shown to increase optimism and life satisfaction and reduce anxiety, depression, and stress. So helps support more balanced emotional baselines. We may also be able to interpret challenges in a more constructive and meaningful way. And social bonds are strengthened with persistent practice as well. It may be that we are more tied to our well-being and perceived supports from others. Psychologically, but beyond mental health, gratitude also modulates stress levels, which really affects our body. We see cortisol reduction and improved automatic balance, leading to a calmer stress response in the body. Better sleep and cardiovascular markers can be seen, and enhanced immune function, supporting that general well-being. Long-term changes in baseline happiness. Research also suggests that consistent intentional practice may help shift baseline happiness in both the short term, weeks to months, and long term, months to years. So we'll look a little bit more about this and those daily activities that may create our attention to naturally focus on more positive things and affect us in the long run. So gratitude at a lifestyle. There may be real benefits to trying to enhance gratitude and incorporate some practices into your lifestyle. Practicing builds your mental muscles, so to speak, to show up with positive emotions. So next, let's take a look to really evaluate your individual tendency to feel gratitude. Then we're going to explore some challenges related to practicing gratitude. And finally, we'll have a chance to really discuss strategies and practices to enhance this day to day. So let's do this reflection exercise. Take a moment to grab some scrap paper near you or open a sticky note on your computer and just record answers to the following questions. Number one, do you feel like you have a lot to be thankful for in your life? Number two, if you made a list of all the things you're grateful for, would that list be very long? Number three, when you look at the world, can you find many things to be grateful for? Number four, do you feel like your appreciation for life and other people has grown stronger as you get older? Number five, do you frequently experience moments where you appreciate someone or something? And last question, do you appreciate a wide variety of people in your life? Now, these questions are from something called the Gratitude Questionnaire, which is one of the most widely used instruments to assess dispositional gratitude. And that's been studied and validated across cultures. It's designed to be quick, under 5 minutes, easy for anyone to administer, and that makes it really suitable for both research and personal reflection. Now, you may have found it difficult to answer yes or no. Perhaps you were thinking, oh, most of the time, or yes, sometimes, but. And that's because when this is performed in a clinical setting, each of those are presented as statements, not questions. And they're scored on a rating scale of 1 to 7. Some statements are actually reverse scored to reduce response bias. So there's a whole clinical application here. But for our purposes, we're just using this as a reflection to help evaluate individual tendencies to experience gratitude. And that might help you determine if it may be useful to incorporate some more gratitude practices intentionally in your life. So let's better understand some challenges related to experiencing gratitude. Here's a list of common challenges. Negativity bias. As a survival mechanism, the human brain has evolved a tendency to focus on negative information over positive information. We more naturally may tend to turn towards the negative. Psychologist Rick Hansen described the mind as like Velcro for negative experiences and more like Teflon for positive ones. An act of kindness could be forgotten, but the painful memory of an argument or failure or embarrassment that can stick for a lifetime. We can rewire our brains to strengthen positive information and emotions, and neurons that fire together wire together. So the more we have certain types of thoughts, the stronger that tendency may be cemented in our brain. Can you see patterns of negative thoughts or emotions that might block you from tapping into gratitude? Has negativity become somewhat of a habit for you in a particular way, like complaining or ruminating on the same regrets over and over? Cultural influences. We're inundated with messages and images that can condition us to be dissatisfied with certain aspects of our life through advertising, entertainment, social media. What effect do these influences have on you? Lack and wanting. We all desire things in life, but do you have ambitions or aspirations that might be unhealthy? Do any of your desires call you to feel unhappy with your life as it is? Are you convinced that a future accomplishment or attaining a certain thing will fix something? Comparison and envy. Do you fall into this pattern? Are there specific people who might trigger this tendency, or does it stimulate dissatisfaction with a particular part of your life? Does it, again, link to use of social media and kind of fueling unhelpful comparison patterns? Expectations. Are there ways you could challenge or modify expectations? Could this help you find more satisfaction, no matter how you once thought something was supposed to unfold? And automaticity. Are you sometimes so busy that you aren't mindful of the everyday good things in life? Are there particular routines or times of day when you slip into autopilot? So these are just possibilities, things to think about and evaluate for yourself. A lot of overlap between these different themes. Studies in the field of psychology show we might have a set point for happiness. Perhaps you know someone with what might be sort of a permanent disposition of happiness. They're always joyful. They always seem to be positive. Or maybe someone who seems a bit more like Eeyore, the pessimistic stuffed donkey from Winnie the Pooh, right? This isn't meant to be judgmental, but to understand that we likely have a predetermined set point for happiness, influenced by a combination of factors, including our genetics, our biochemistry, and circumstances, which we've been born into. That's why being rich or famous, or even winning the lottery, doesn't necessarily increase our experience of happiness, at least not for long. And how do we know this? Well, a landmark study compared long-term happiness of major lottery winners to individuals who suffered life-altering accidents, spinal cord injuries. Before their life-changing events, both lottery winners and accident victims reported similar baseline happiness levels compared to a control group, a group that experienced no major life-changing events. Both life-changing event groups had changes in their happiness level immediately after that life-changing event. But then both groups showed adaptation, the tendency to return to a stable level despite major changes. Winners' initial euphoria really faded as they adapted to new circumstances. Victims' initial despair gradually improved as they adjusted to their new reality. And at the 10-year follow-up, both groups' happiness levels were back to their baseline, like the control group. So this study supports the idea that even life-altering events like winning the lottery or suffering a spinal cord injury tend to have temporary emotional impacts, but don't permanently change long-term happiness baselines. Now, does that then contradict the idea of practicing gratitude? No. Let's look at a key distinction. External events like winning the lottery affect happiness episodically and are subject to rapid adaptation. Deliberate cognitive practices like gratitude actively reshape our baseline outlook, potentially offsetting natural adaptation. So What does that mean? Consistency is key. According to some research, people who keep gratitude journals are 25% happier at baseline. They sleep 1/2 hour more per evening and exercise 33% more each week compared to those who don't keep gratitude journals. Okay, we know correlation does not equal causation, so we can't say the gratitude is the reason for all of this happiness. But if you're the type of person that cares about sleep and exercise, perhaps you are the type of person, generally trying to do these other healthy practices, and gratitude practices definitely fit that. So some examples: take a moment to think about positive things that happen during the day. Make a habit of writing down things you're grateful for. Try listing things and be specific, like, I'm grateful for my dog because she loves me unconditionally and makes me laugh. Be mindful and savor experiences. Try to notice positive moments as they're happening too. Relive the good times. Relive positive moments later by thinking about them and sharing them with others. Write to yourself or someone else. Write a letter to someone you feel thankful toward. You don't have to even send it if you don't want to. Just the act of writing it makes a difference. Write a letter to your past self in appreciation for all the fantastic actions and decisions you've made that are benefiting you today. Create a gratitude box or jar, a physical container where you can store gratitude memories. The idea is to write something down or collect a memento to remind you of what you're grateful for. When you're feeling sadness or struggling, reach inside and pick an item or read a note to be reminded of what you have to be grateful for. Start weekly gratitude notes or some type of recognition system with those around you. Find a gratitude buddy or pair up to try one of these suggestions. Yes, and this exercise can help challenge the habit of complaining. So this is a trick to reframe a negative thought. Every time we catch ourselves in a complaint, we can then say yes and in order to help flip that negative observation and incorporate a positive one. So great, my friend is 20 minutes late for our coffee meeting. Yes, and now I have an opportunity to call another friend while I'm waiting, right? I'm disappointed that my weekend plans are canceled last minute. Yes, and I'll take this opportunity to spend time with my nephew and give my sister a break. Oh, I have to spend my Saturdays sick in bed. And yes, at least I have an excuse to catch up on my favorite show on TV. So make a visit. Tell someone you're grateful for them in person. Say thank you in a sincere and meaningful way. This is probably one of the most ancient practices, the simple act of saying thank you. We may say it as an automatic reaction many times. The challenge isn't just to say it, but to really be in the moment and feel it, to convey that appreciation to someone. Thank you for coming to my party really changes to thank you for spending time with me last night. I really enjoyed catching up and having fun together. It meant so much to me. More ideas to share this practice. So 3 things. List 3 things to be grateful for. Keep it as a diary. Enter it at the end of every day. Or maybe use this as a start for every Monday on your calendar. Do it repeatedly. Start at 10 and list 10 things you're grateful for and be specific. Here's a fun practice, A to Z. Create a list from A to Z of items, people, experiences you love. This is also good to help fall asleep with a peaceful mind at night. And you can see how these can be turned into shared experiences, right? With a group, with your family. You can kind of all read off and everybody take a letter as you go through the alphabet. Portrait, think of someone or something you appreciate and list all the reasons and memories surrounding that person or thing. Gratitude boards, a vision board specific to gratitude that reminds you in pictures or words of what people, places, things, and experiences create happiness in your life. It focuses on present abundance instead of future aspirational yearnings. A reverse bucket list. This is a list of things we've already accomplished rather than yet to be had experiences. Turnaround. Take a pen and paper and draw a line down the middle of the page. On one side, create a numbered list of all the things that are bothering you in the moment. On the right side, try to turn each one to see if you can find a positive part or silver lining. Eyes shut. Close your eyes, mentally picturing the space around you. From there, how many things can you see in your mind's eye for which you're grateful for? This could be anything. Then think about what your life would be like without those things. Open your eyes and take a moment to appreciate everything as it is. 5 senses. Close your eyes again and see if you can identify the current sight, sound, taste, texture, and smell of the moment. Explore your appreciation for each sense. It's a great idea to focus on your senses when you try any of these gratitude exercises, because the more senses you engage, the more active your brain becomes in this process. The gratitude game, best played in a group. The game starts with the first person mentioning something for which they're grateful. For example, family time. The next person jumps in and takes the last letter of that item. So it would be E in this case from family time, and comes up with something they appreciate using that letter. For example, eggs sunny side up. Nothing can be repeated, and the game becomes really interesting when people come up with things that they really have to kind of like explore in a different way, right? Kind of fun coming up with words starting with Q, X, and Z. Gratitude at work. So these actions support values and behaviors in the workplace. Writing a thank you card, bonus points if you come up with language yourself instead of outsourcing to AI to write it, because again, this activates those important neural pathways. It does matter. Finding that gratitude work buddy and sharing some wins. Practicing gratitude countdowns with others. Maybe everyone lists one thing they're thankful for to kick off a meeting. Start a meeting or discussion with what's gone well when you're the one presenting information. Create a team word cloud doc for everyone to enter what they're grateful for, or some kind of repository that makes sense in the same way. Appreciate and recognize others' contributions and accomplishments on a regular basis. Make it a weekly habit. Set calendar reminders to do it too. Layers of gratitude. Practicing will deepen your level of gratitude, which will turn into more benefits. So there are levels of really practicing these techniques that go beyond the basic. Level 1, passively grateful. Not often thinking about gratitude or aware of what it can do. It just kind of comes when it comes, right? Level 2, being aware. Awareness and adopting a mindful practice of seeking out things to be grateful for. Taking time to write down 3 things to be grateful for at the end of each day. That would be sort of a level 2 practice. Level 3, gratitude becomes hardwired in the brain, a more perpetual state of gratitude. And level 4, that's where you no longer need something or someone to create that feeling of gratitude. That exists as a more internal filter for everything. So thinking about these levels, these different sort of places, where might you be at right now? Where would you like to be? Where could you see yourself sort of feeling? So I hope this discussion, these ideas presented today, I hope they've created some space for thought, maybe added some additional insights, and sort of gotten you considering why gratitude's important. And I hope you take time to sort of think about, how to best support the use of gratitude for yourself, for those around you. And so with that, I'll turn the presentation back over to Jason.
Awesome. Thank you, Dr. Mikowski. Excellent information. Great, great amount of resources. Gratitude, it's something that we try to instill here at my house with, my wife, my daughter, my close friends and family, and much more. Relying on family is something that is key, and I'm often thankful for the relationship that I have with my family when it comes to specific resources. At Excellus, our teams are here. We're always trying to connect with our membership and hear from our membership. So it's workshops like these where we have that excellent opportunity to meet you, to work with you. But, if, in the event that you are looking, thought we would cover some specific resources. Our Find a Doctor tool. So in terms of behavioral health, so if you are at any point looking for additional talk space, certainly psychologists, psychiatrists, you have access to that in staying in network, but those providers can be found by logging into your Excel account and using the Find a Doctor search tool. So if you've never tried it, certainly, if you're looking, that's definitely a great option there when it comes to, helping with the daily pieces that we have that, if stress is taking over, if work is something that's just impacting our life, if you want to reach out to an in-network behavioral health provider at the health plan, you have that capability. Telehealth, I know we've done, countless promotions of MD Live and several workshops and registering for it. But again, it's a great outlet to turn to for accessing behavioral health psychiatrists, therapists as well, through confidential functions within the MD Live platform. We've had that as an offering for close to 10 years to our membership and groups that have MD Live. So you do have to register for MD Live. So if you have yet to do that, maybe something is impacting, a dependent or somebody at home, school, something like that, MD Live is a great resource, and having that virtual visit, perhaps saving time, right? Anywhere from 1 to 3 days of accessing an MD Live behavioral health provider there. So you do have to register. You will need your subscriber ID. And then finally, connecting with a care manager. I think this is also a kind of a best kept secret, something that may not be known to members, but at the health plan, we do have our licensed clinical behavioral health specialists, our licensed social workers, pediatric care managers, and much more that you can engage with at any point should you have any questions. You can connect with them if you can see some of the behavioral health conditions. Maybe gratitude is just not there, and something in terms of a daily anxiety or something is there. Maybe it is grief or loss. You can connect with our care management team. Dr. Mikowski, and lead with our behavioral health as a medical director. Just a great opportunity for you to connect in that space. You can always call our care management line. You can see the number there, 877-222-1240. That's available Monday through Friday, 8 a.m. to 5 p.m. If you are into technology, WellFrame is a direct way to confidentially text with a care manager, so you can really build your own with what your needs are. And if it is in the space of behavioral health, you can start there. But for anybody that wants to give it a try, all you have to do is download WellFrame. That's our care management app. The access code is Excellus Welcome. So again, 3 high-level resources that are available to you should you be in need, should you want to gain more practice and being more grateful from what's around you and talk to somebody in a confidential matter. These 3 resources are available to you at any point. So just wanted to highlight some of those. Definitely appreciate the time today. So with that, just see if there's any discussion opportunities, or if there's any questions from anybody that's had a chance to join today's presentation. So I don't know, Kylie, Jess, Dr. Mikowski, if there's anything in the chat or anything that anybody wants to bring up at this time.
Yeah, I don't see anything in the chat yet, but please do feel free to ask a question, or I'd be curious to know if anyone who is listening live on the call today has used gratitude, and what's your experience? Is there gratitude journaling or anything that's made an impact for you? I am really grateful we have resources available through the plan that can help support wellness. think of gratitude as like that foundation wellness though, right? Like it is like sort of the foundation of a house. It's helping to support that general well-being. And some of these resources we mentioned, you cannot gratitude your way out of anxiety or depression or grief. Those are deep and challenging experiences for many people. And so, that is kind of the next level. So I don't want anyone to think that that is what I'm suggesting here, but these are just general practices to help enhance well-being and can certainly help people who are experiencing things like anxiety or depression or grief. They are generally complementary and can certainly be impactful there too. So,
Great point. Thank you, Dr. Mikowski.
Yes, thank you both of you. I just wanted to follow up and touch on WellFrame. As Jason mentioned, we are hosting a WellFrame webinar in August, excuse me, as well as a WellFrame registration campaign. So anyone who creates a WellFrame account will be entered to win a prize. The WellFrame, excuse me, registration you can register for by emailing hcwellness@tompkins-co.org, just like you did for this. And that is taking place on August 12th, which is a Wednesday at 12:30.
Awesome. I appreciate the time today from the Excellus team, Dr. Mikowski, myself. We definitely thank you for the time. Thank you for the opportunity. With that, if there's nothing else, we can conclude today's presentation and workshop.
Thank you, everyone, for attending. Jason, Dr. Mikowski, we appreciate you taking the time to meet with us and our members.
thank you. Thanks
Thank
for
you.
having us.
Have a great day.
You too, thank you.